Domilan, yes, again, Your Excellency, the First Lady of Botswana, and the Ambassador of Merck Foundation More Than a Mother, my dear sister and friend, Her Excellency Mrs. JANE MASISI. Honorable Ministers, Assistant Minister of State, President and Deputy Permanent Secretary of Information Broadcasting, media representative and award winners and Merck Foundation alumni, thank you very much for being here with us for the first Merck Foundation Health Media Training in partnership with the First Lady of Botswana, Mrs. JANE MASISI. Don't call her Cinderella, call her Cleopatra. So happy to be with you here. And you understand how strongly we believe since long time in the role and the critical role and important partnership with media and art to sensitize the communities and to be the voice of the voiceless. You enter every house all over the world. So you have a very important responsibility to create a culture shift, to separate the myth from the facts, and to break the stigma around infertility, to support girl education, to end child marriage, to stop FGM, to stop GBV, to raise awareness about diabetes, early detection, prevention, hypertension, early detection and prevention, promote healthy lifestyle so you can lead our communities to better life, healthier life. This is your role and responsibility. Therefore, we are very interested in partnership with you. Dearest media representative, I'm so happy I'm here today because we met, maybe some of you online, but we never met in person in Botswana for the first time. And thanks for the First Lady that she made this happen because this amazing organized event. And please take it seriously. Please listen to all the lectures, but also watch the animation films. And after any and every animation film, there is a feedback form as part of the training. When you respond to it, we will understand that you already grasp the information in the film, and also you give your feedback if you want any improvement for our next films, a new topic that we can address. But also, I invite you to apply for our awards. We have fantastic 4 awards for each category. We have the Media Recognition Award, Film Award, and Fashion Award, and Song Award. And one under Merck Foundation More Than a Mother theme, where we advocate for everything with regards to girls' education and women's rights and stigma and fertility. The other one about healthy lifestyle, diabetes, and hypertension, early detection and prevention. So in total, there are 8 awards. So based on your specialty, what you're doing as well, if it's your online or radio or TV or newspaper, you have your place and you are eligible to win a very important award with us and to be Merck Foundation champion to raise awareness in your society and your community, and you will be work closely with Her Excellency, the First Lady, in her campaign and advocacy building. So this is very, very important. Another thing I want to emphasize, I want every one of you to also believe in what we are doing today. Breaking the stigma of infertility, supporting girls' education. So can you repeat after me? No to infertility stigma. No to infertility stigma. Yes to girls' education. Yes to girls' education. So this is the mottos of today. And of course, I'm very looking forward to you to benefit and to enjoy this media training session, and to send me your feedback and be with us always to see how you will come up with coverage for this media training in the purpose of, or the objective to also educate other people who will read about it. And believe in your social media, also power, as we know. We have 6 million followers in our social media, and I'm sure that each one of you has social media outlet in addition to his normal work. So please post everything today and let us spread the word and create a culture shift starting from today. Thank you very much.
Your Excellency, the First Lady of Botswana, Mrs. JANE MASISI, Honorable Ministers, distinguished partners, healthcare providers, distinguished media experts and media partners. So thank you very much for being here for the first Merck Foundation Health Media Training with our long-term partner, Her Excellency Mrs. JANE MASISI, the First Lady of the Republic of Botswana and it's important, Ambassador of Merck Foundation More Than a Mother. I'm very happy that we have just a few hours ago officially launched the Merck Foundation Programs in the country in partnership with Her Excellency to underscore our commitment towards building healthcare and media capacity, patient care landscape transformation, ending GBV, breaking infertility stigma, and supporting girls' education. And that's all in the presence of His Excellency, the President of the Republic of Botswana. So it was a real honor to meet him, and it shows how much emphasis the government also puts onto these actions. As you all know, our long-term partnership with the First Lady began in 2018, and we have achieved quite some amazing milestones. I'm proud to share with you that Merck Foundation has provided 45 scholarships of 1-year online PG diploma and 2-year master degrees for local doctors from Botswana in many underserved and critical medical specialties, which is considered an excellent number for a population of 2.7 million. And we are still going to provide more scholarships to local healthcare providers nationwide to help to improve the healthcare landscape in Botswana. Through our scholarship program, Merck Foundation is contributing to advance healthcare capacity and transforming public healthcare in Botswana and the rest of Africa and other developing countries. Therefore, till today, Merck Foundation has provided more than 1,810 scholarships for young doctors from 52 countries in 42 critical and underserved medical specialties. So I'm proud to share that many of them are becoming the first specialists in their specific countries. So, dear media partners, we strongly believe in the critical role that media plays to sensitize our communities in order to address sensitive social and health issues in Botswana and also in the rest of Africa. And today, through our first physical health media training in Botswana, we'd like to emphasize on your potential contribution to influence our society to create a cultural shift with the aim to break infertility stigma, support girls' education, stop gender-based violence, end child marriage and FGM, and women empowerment at all levels, and raise awareness about early detection and prevention of diabetes and hypertension, because diabetes and hypertension is also steeply on the rise on the whole continent. The program today will address the many medical and media experts. I'm happy to share that as part of Merck Foundation's Health Media Training Program, we have trained over 3,200 media representatives from over 25 African countries till now, so basically over the past 10 years. It's quite a big number. I hope you all will also embrace this opportunity today to learn, network and collaborate to educate and sensitize your communities across your beautiful country of Botswana. Thank you very much, and I wish you a good afternoon and a lot of interesting working environments and working sessions. Thank you.
To the media, After exposing you to such a good program, I hope I will not see any memes where you're calling me Cinderella. Thank you. That's part of being friendly and also accurate reporting. I think let's keep to the main facts, and I hope it will be highlighted during the session. Facts, facts, facts. Positivity, positivity, positivity. I hope that all of you, after you leave this room today, all you'll be planting out there is positive energy. If you've been planting positive energy in your space, make it positive squared. Thank you. Ms. Mundlengane Baiti, Permanent Secretary, Government Communications, Ministry for State President. Reoshinka Tsiang, Deputy Permanent Secretary, Information and Broadcasting Ministry for State President. Professor Frank Stagenberg Haverkamp, Chairman of Merck Foundation Board of Trustees. Senator Dr. Rasha Kelej, CEO of Merck Foundation and President of More Than a Mother campaign. Participants from the academia, media practitioners who are here, and members of the media who are capturing the scenario today. Let me start by expressing my appreciation to Merck Foundation for offering the Health Media Training Program, realizing that media plays an integral role in creating awareness and generating information. Merck Foundation has provided a health media training program which focuses on responsible reporting while taking into account media ethics when dealing with highly sensitive issues such as infertility. While this session represents the second session, it is the first in-person training that has been hosted in Botswana. Some of you may have attended the online session offered previously. Thank you for the valuable feedback that you gave us then, last year. Some of your feedback was incorporated in what will be the current offering today so that it is enhanced. For this session, I thank you, Merck Foundation, for accommodating our request for additional training on social media and photography. I always appreciate your generosity and responsiveness. In my culture, we say a child who does not cry will die in the cloth that carries them. So I was that child that cried out that you include social media and photography training, and you responded. By making this additional request, I'm hoping that through this initial exposure, all of you can give thought to using social media or photography to improve health outcomes. We are all aware that media plays a crucial role in disseminating information and can play a crucial role in community development as it influences public perceptions and health-related behavior. The training connects your capabilities as media practitioners with skills that support you to negotiate the complexities of health meets science, meets culture. For the academics, there's an opportunity to grasp the basics on media and sensitive issues, a topic you'll need to highlight as you engage your students studying public health and community development. The knowledge that you'll acquire this afternoon will inform you of best practices as you continue to advocate for communities. Health issues are sensitive, and I cannot stress more how words matter, expressions matter. How you tell the story counts. For example, as predicted during the COVID-19 pandemic, mental health was said to be the next pandemic. Here we are, all of us know or are related to someone with a mental health challenge. We are aware of the stigma, and take this as an example as media practitioners. How can you reduce the stigma? How are you going to report on these stories? You should see this training as an opportunity to learn how to ask the right questions and tell that story. I'm currently very interested in finding out from you all how we can encourage women to go for cervical cancer screening, knowing that early detection saves lives and that cervical cancer is the leading cancer amongst women in Botswana. So there's an assignment for you. If the resource persons are not going to give you an assignment, you've got an assignment right there from me. How should we call cervical cancer, or how should we name it in our language? Should we continue calling it that on Setswana? How can we convince our men to also be part of this movement against cervical cancer? Infertility is another topic. How does media break the stigma associated with infertility? I therefore urge you to use this opportunity you've been given by Merck Foundation so that it adds value to your current vocations. May it be impactful in your work now and in the future. I once again thank our very valuable partner, Merck Foundation, for affording this group of wonderful media practitioners. I'm saying wonderful so you don't call me Cinderella. I once again thank Merck Foundation for affording this group of wonderful media practitioners the opportunity to gain insights in health media reporting. Please enjoy it, and at the end, as mentioned before, do respond to those feedback forms so that next time we come with an even enhanced product, but also it will just add value to everything that we do with you. Thank you very much and enjoy your afternoon. Let me thank the resource persons, actually. I forgot to thank them. Thank you so very much. You'll also be evaluated, so do your best when you make your deliveries. Thank you so much. Bula.
So I'll be talking about infertility, and I'll discuss female infertility as well as male infertility. Before I dive into infertility, one perhaps needs to know how fertility happens in the first place. You have a couple, a male and a female, and they have to come together intimately through sexual intercourse, and then a baby is born. So let's talk about the female reproductive system. In the female reproductive system, you have a female is born with eggs. When a baby is born, they already have the number of eggs that they will ever need in their entire life. And it's usually millions of eggs that are found in the ovaries. And what happens every month is that after some time you reach puberty, and then every month you've got these eggs growing and proliferating, and at some point you've got what is called ovulation. And after ovulation, the ovulated egg moves into the fallopian tubes, and if it so happens to meet a sperm, fertilization occurs, and then the fertilized egg moves down, a zygote forms, it gets implanted into the uterine lining, and then it grows into a fetus, and after 9 months, a baby is born. And then, so that's what happens. So we are going to start with female infertility. So it means that if female infertility can happen at these different levels. You can have a problem with ovarian reserve or your eggs. Either you are not able to produce eggs, or you don't have, the person does not have eggs, or the eggs are produced, but they are not able to meet down the fallopian tube to get fertilized because the fallopian tube is blocked. Or the egg is able to move, but because there's a problem with the uterus, the fertilized egg is not able to implant into the uterus so that the baby can grow. So those are the different levels. However, that's not the only thing. That's the anatomy part of it. There is the physiology part of it. How does the body regulate one to even start puberty in the first place? And for a woman to have menstrual cycle every month, there are things called hormones. These hormones are produced, it starts from the brain. There's an organ in the brain, it's called the pituitary or the hypothalamus. And then the pituitary, they produce the hormones. Then the hormones that come from the brain, then they communicate with the ovaries so that the ovaries can produce the eggs every month. So if there is a problem with the hormonal imbalance, and one of them will be the estrogen, you are not able to ovulate, or you are having an effective ovulation that you're not able to ovulate every month. Sometimes you ovulate. So sometimes we call it hormonal imbalance. It means that the egg cannot then ovulate, and then the woman cannot conceive. So that's the physiology part. So there can be diseases in the pituitary gland or in the brain that can affect the hormones being produced. Okay, so that's the physiology aspect of it. But sometimes the physiology and the anatomy is fine, but there are antibodies that are produced. Antibodies is like when you see something as foreign, and that chemical then finds that body, that part of the body, and then is not able to, so sort of it repels, the sperm and the egg repels each other, and they are not able to fertilize. So with that background, we'll talk first about the female fertility issues. So the reason we have a lot of infertility in Africa or sub-Saharan Africa is because of the low resources that we have. We have a lot of infections in Africa compared to the developed world, where they have more of the non-communicable diseases. In Africa, we still have a high burden of infections, and some of these infections end up causing a lot of complications. And the reason we have complications arising from these infections is because we have delay in diagnosing these infections, first of all, and number two, there's also even delay in seeking help. You know, in African setting, we have what we call health-seeking behavior. The person will prefer maybe to go to a traditional doctor before they go to the hospital. And then some traditional doctor, they even make things worse because they give them things to put under, which then make the infection even worse. Or even maybe some of them, they don't have resources to treat the infection adequately, and when the infection is not treated, there can be consequences that do happen. And because of abortion laws in most of African countries where abortion is not legal, some women end up seeking unsafe abortion, and that itself can cause scarring in the uterus. When the uterus is scarred, baby is not able, the fertilized ovum is not able to implant, and then you are not able to house the baby, and then you lose the pregnancy. Basically does not happen. Or this unsafe abortion itself can cause infections, and these infections can cause blockage of the tubes or also cause scarring of the uterus. And some infections can be so severe that the uterus end up being removed. So that's that. So those are the consequences of unhealthy seeking behavior or infections. We don't have a lot of female genital mutilation. I haven't heard about that in a long time. We used to go to Bokwera le Bojale, where we used to have that happening, but I have not heard of that happening in a very, very long time, and we have not seen anybody in the clinical setting who have undergone female genital mutilation in Botswana. So we must say that's a positive as far as girl-child health is concerned for Botswana. And then, of course, exposure to chemicals as well can cause that. Apologies, I had to stretch to read, and I lose my voice. And so if you have untreated infections, those are the consequences of untreated infections. So we know that, so what the message we should send out there is, sometimes also there is a stigma of associated with just developing a sexually transmitted infection and seeking help. So people tend to seek help late, and they want to hide that I have a so and so infection or some infection, or have a discharge from the vagina, or even men, I have a discharge from the penis. So they delay in seeking help. So we should sensitize the community that when you have an infection, you should be quick to seek help, because if you delay health, there are consequences that are going to happen, and one of them can affect fertility. And this goes for both men and female. Seeking help should not be something that is shameful if you have a sexually transmitted infection. But unfortunately, the stigma starts there. You can't seek help because people are going to think what you had unprotected sex or something in that nature. So, and also, the reason women have to have regular checkup, because it's not all the time that the women will have a discharge. Some of these women, they've never experienced a discharge in their life, but they come and then they're not able to have a child. They do the test and they are told that their fallopian tubes are blocked. They'll be like, but I've never had an infection. they just had an infection. It's just that some of these infections are not showing, or they are not manifesting clinically, so they don't have symptoms. And sometimes they do have discharges, but sometimes they also do not have discharges. So that's why regular checkup is important. Maybe the only thing that they'll have is that I have a little bit of pain in my lower tummy, and they forget about it. But when they do have that, they should seek medical attention so that the infection can be treated early to avoid the complications. And then we know that HIV is prevalence of HIV is high in Botswana. Luckily, HIV is very well controlled, and we have reached targets for the WHO and USAID for the targets for HIV. However, even though it has been controlled, we still have new infections coming, and we still have people coming with severe AIDS, and they've lost a lot of weight, and because some of them have not even started antiretroviral therapy, or they do start antiretroviral therapy, but they default along the way, and then they start having AIDS symptoms. There's a difference between HIV and AIDS, but apart from that, HIV itself is toxic, and it can affect the ovaries, it can affect the brain that I spoke about, the hypothalamus, especially the pituitary, so the body is not able to produce hormones well, and then it can also affect how the body regulates the hormones. And it also predisposes one to having these chronic infections. And apart from that, HIV is been associated with obesity because of the treatment that we use to manage HIV. Some of the antiretroviral therapy have got side effects of causing obesity, and obesity is becoming an epidemic globally, but more so in people living with HIV. And obesity has been associated with problems with the hormones that regulate fertility and reproduction. So that's how HIV can also affect fertility. So one needs to know that these infections gets transmitted from partners. So it's important, the responsibility of the couple, both male and female, to make sure that they produce safe sex. And as much as possible, what we preached during the HIV, the abstain, condomize, and abstinence or stick to one partner, should also be preached as far as prevention of infertility is concerned, that they should either condomize or stick to one partner and make sure that they do produce safe sex, because multiple sexual partners produce risk of one developing infection. And the complications I mentioned is the blockage of the tube. And when the tube is blocked, then you can actually have a pregnancy happening. It happens, and then you have got what is called an ectopic pregnancy. And then some will say, so because the pregnancy is not implanted in the uterus, it is in the tube, and sometimes it can actually fall into the abdomen. It's an among thing. And that is very dangerous, because you can just burst, because the space is small, the tube is small, it's not meant to hold the baby. So because the tube is small, it grows, and then it can burst, and the woman can bleed to death and die. So it is dangerous to have an ectopic pregnancy. And so what are some of the things that one can do to increase the chances of becoming pregnant? We've mentioned infections, we've mentioned hormonal issues that can occur from different conditions, really. And some of the conditions that can affect the uterus could be uterine fibroids, it could be endometriosis. I'm sure there's a lot of media coverage, there's even endometriosis day. We all know what endometriosis is, and all this affects the implantation. It could be blockage of the tube, it could be the hormones. So some of the things that one can do is just to make sure that you stay healthy, really. Exercise. I know in Africa we believe in looking and having a bit of meat. A bit of meat is okay, but when it becomes obese, and especially in women who are trying to have children, obesity, it affects the hormones and it prevents a woman from ovulating. So because of that, we encourage that one should do a moderate exercise. We don't encourage intense exercise because too much weight loss as well can cause hormonal imbalance to the point that your body shuts down, the brain shuts down and is not able to produce those hormones that then stimulates the ovaries to produce estrogen and progesterone, and you are able to ovulate. So when you are either too thin or too big, you are not able to ovulate, and those are things that can cause infertility. So moderate exercise is healthy, but not intense exercise. And so healthy eating is good, because if you eat unhealthy, some food can be toxic, and there's something called antioxidants. So if you eat healthy meals with good vegetables, you should be able to avoid weight gain, and you should be able also to avoid extreme anorexia. And some people with anorexia nervosa actually don't have children. I'm struggling. Yeah. And smoking is very dangerous, not only to the lungs, to the heart or your blood vessels, but also to fertility. Smoking is dangerous, and things like marijuana are dangerous. Things like illicit drugs and cocaine and heroin, they are all dangerous. So if a woman is seeking a pregnancy, they should avoid smoking, and they should also avoid alcohol. One thing about smoking and alcohol is that sometimes the woman can actually get pregnant. And fertility is not just inability to get pregnant, but also inability to carry the pregnancy to term to deliver a healthy baby. So sometimes the woman can get pregnant, but because of the smoking or the alcohol, they are prone to miscarriages. So these are some of the things that one needs to consider when they are planning on getting pregnant, is that they should quit smoking, and they should also stop alcohol even during pregnancy, because they can cause miscarriages. And then there are toxins. So basically, avoid a stressful environment. Either the stress is coming from outside or the stress is coming from within. So I spoke about female infertility, and we went through the anatomy of the female body and the hormonal profile of the female body. And by the way, for one to say that the couple is infertile, they must first of all have had unprotected sex for a minimum of 1 year. And the sex must have been regular, because sometimes they can come and say, we are not having a child, but they're having sex once in a month. So that doesn't qualify as a regular sex as far as health professionals are concerned. Regular sex, we're talking about at least 3 times in a week. Then we say you're having regular sex. And this sexual intercourse should be, make sure that it's unprotected, and the woman should not have been on a birth control for a period of at least 1 year. So for a male, infertility is that you have not been able to impregnate a woman whom you have been consistently in partner with, having regular sexual intercourse 3 times a week, unprotected, but you are not able to make the woman pregnant. Then we can say that there is a male infertility. And so talking about stigma, when a woman gets married, for example, so meaning that they have to give birth to a child. Is the problem of the woman all the time, and to the point that it has caused divorces, and it has caused severe depression, and even some women have committed, and some have attempted suicide, and even some have become successful because of this stigma that when a child is not coming, it's because of the woman. I'm here to tell you that it's not always the woman. In fact, it's a 50-50 situation. A man can also be infertile, or a man can also have, I don't want us to use infertile. Maybe we should use they have infertility. Because, so let's talk about the anatomy of a male. Man has got, they also have they have hormonal regulation that's coming from the brain. They produce certain hormones that then communicate with the testes. The testes then produce testosterone, and then testosterone is the one that tells the body to produce sperms. The man is not born with a sperm, like a woman who is born with many eggs. So the sperms start produced after puberty. So then once the sperms are produced, they have to now, when during intercourse, then there's ejaculation, and the ejaculation has to be that the sperms are able to move from the testes. There's a tube that then goes and then through the penis and then goes into deposited into the woman. So infertility can occur at different levels. It could be a hormone problem that a man is not able to produce testosterone because they've got a problem in the brain, or they have a problem in the testes themselves. So I will start with the testes. There are some things that can cause, I'll move on. I've already said that it's 50-50, so I'll move on. So there are infertility can be, you are born with it, that maybe you are just destined and you will never have a child, but you can acquire it because of infections and some conditions, diseases that you can acquire as you grow. So some people can born with genetic issues that make them not being able to produce sperms. And because of that, they are not able to have children. Or a man can have trauma to the testes and they are not able to produce sperms. Maybe after puberty, we're talking about things that usually happen after puberty. That's when sperms appear. Or there's something called torsion, when the blood supply to the testes gets interrupted. Especially it happens in young kids. And then you see that the scrotum swells, and then they say you have torsion. Later on in life, you're likely not to have be able to bear children. There is another thing called MOKGWEETSI in Botswana. We call it mumps, where the things swell up a little bit. When you have MOKGWEETSI or you have mumps as a baby, as a child before puberty, that's fine. It doesn't usually cause problems. But when a male has mumps after puberty, it's most likely to affect the testes. And unfortunately, those men who have mumps after puberty, they are at risk of developing testicular damage from the mumps, and they are not able to get pregnant. Not to get pregnant, to impregnate a woman, because they are not able to produce sperms. So those are the testes. Or a man can also have infections in the sexually transmitted infections. So the infections can cause orchitis, which infection in the testes, and then it can also, because of infection, the tubes that then takes the sperms out of the testes to be ejaculated is not able to pass, because there is blockage that has happened from an infection. So signs of infection in a man also include pain and they can go to discharges, just like what could happen in a woman. But they can also maybe not have or would have had those discharges, so that can happen. So that is the male sources of infection. And when we come to, those are the blockages. And then when we come to physiology, it could be the hormones. The hormones could be that you have a pituitary thing that's sitting there, like a tumor or an infection or TB of the brain or something. Then the body shuts out from producing those hormones, and because hormonal imbalance, you're not able to produce testosterone. And we've spoken about alcohol. Alcohol is very, very toxic to the testes. Too much alcohol can cause the testes to even atrophy and become smaller. And if that happens, man is not able to produce, the testosterone is not able to produce enough sperms, or the sperms that are produced are unhealthy and are not able to fertilize an egg, or they can't even move. And it's very important as well to talk about the fact that spermatogenesis or production of sperm happens under certain conditions. That's why creation has made the testes to be lower than the body, because it needs a lower temperature. So that's why we advise men not to wear very tight-fitting underwear, so it should be as loose as possible. And people who sit down for a very long time, truck drivers who sit down for a very long time, they can also be prone to developing infertility, because the sperms are not able to be at a certain temperature. Some men also can have testes not in the scrotum, but they are in the groin above, just below the abdomen. That temperature is too warm for the sperms to be formed, and they are not able to form the sperms. So the environment under which sperms are needed is very important for the sperms to be formed. And I want to talk about something that, well, we spoke about alcohol. Smoking is also dangerous. There is something people use, there are bodybuildings this time, and people take steroids and even testosterone to build their bodies. And sometimes men are prescribed testosterone, and because of that, the body shuts down. There is no communication between the brain and the testes to produce testosterone. It's very important for the testosterone that is produced inside the testes, not the one that comes outside. The one that comes outside, you take it as a pill or an injection. Most of it is injection. It's actually shut down sperm production, because you need a little bit of testosterone inside the testes for the sperms to okay. So sometimes a man says, I don't have a problem. Get sharp. Again, I'm able to perform. But then maybe they are taking these medications, they are taking these steroids, and they feel like they are very, and they will give them a lot of libido. So they might be in not understanding that actually by so doing, taking this outside testosterone, it's actually shutting down their fertility. So I think I've spoken about a lot, and the same thing really, how to prevent this, the same as for the women. Stay healthy and avoid excess alcohol. Is dangerous to the testes and the sperm production. And then avoid any drugs. And if you exercise also, men should not over-exercise, because over-exercise can also shut down the hormone production pathway, and they are not able to produce enough testosterone for reproduction. It's not moving. Okay. Oh. Okay, so that's where we are. Temperatures we spoke about, and when a man takes a bath, they shouldn't soak themselves in a hot bath, because and it become a regular habit, because that affects sperm production. And we spoke about the type of wear they should have to avoid high temperatures. And this thing has a delayed response, but the bottom line is that one, especially the men, is not just the fact that the sperms are produced, it's the fact they are delivered where they need to be delivered, and then the quality of the sperm as well is important. There should be normal morphology, like not defects. Some of them don't have tails, so they can't move, and then there is increase mobility. And then lastly, I just want to talk about the fact that sometimes one might not find a cause. They've looked at the woman and they've looked at the man, and there's nothing they can find, which is what they are called unexplained infertility. And most of the time it could be because either the egg or the sperm produces chemicals that then fight each other and repel each other. Even though the system is okay, they are not able to fertilize one another, and it happens in some situations. And both male and infertility needs to be investigated, because there are potential treatment options that can be done for both male and female infertility. One of them could be that maybe you just have a blocked tube, and you can do an intrauterine insemination, or maybe because the woman has a blocked tube as well, we can actually go in, get the sperm, and then inject it in the woman, and then they can have a baby. Or it's just a simple thing of the hormones not being balancing, and we are able to balance those hormones, and one is able to ovulate properly, and then they do have a successful pregnancy. Or it's just that the man is taking exogenous steroids or acid steroids. It's just probably a matter of just stopping whatever you are taking and allow your testicular function to recover, and you have a baby. So what we need to take from this is that infertility is unfortunately common. They say 1 in 6 might have an infertility issue, and it affects both men and female. And just because one is not able to have a child does not mean it's the end of the world. They are not lesser of a human being, or they are not lesser of a woman, and they are not lesser of a man. And the other thing that I want to say is sometimes the couple just have a boy, and then they say, or they are having a girl child. 4 children, they are all girls, or one sex. I want to say, unfortunately, if there's anybody to blame, it's the man. Yeah, it is the man to blame. Who brings the sex of the baby is the man. Not that there should be any blame. I get it. There shouldn't be any blame. But a man, Runa, we are born with X. Our eggs are just X. And the men, they have an X sperm and a Y sperm. So what type of sperm fertilizes the egg is what determines the sex of the baby. So if it's a Y carrying sperm, the baby becomes a boy. If it's an X carrying sperm, the baby becomes a girl. So we should let it be known that men should not divorce women because they are giving them boys only, not girls, or they are giving them girls only and not boys. The man is the one who determines the sex of the baby. Thank you for listening. Do I take questions, or there are no questions? Okay, I would like to take questions. If there are any, or any area that you like me to clarify, I'll be happy to do so. There's a question, a hand up. Choose the gender of your baby before, because the only way you can choose the gender of your baby usually is when there is IVF, and they can do the sex determination before they implant. But then they can choose whether you want to plant a girl or you want to plant a boy. But under natural conception, maybe you mean when the baby is born. Oh, okay, okay, sure, yes, yes. Oh, okay, yeah. Okay, yeah, that's there. But natural conception, unless you can know the gender of the baby, but if you choose, it will mean then you terminate, which is not something that we want. But IVF, they can do gender testing and genetic testing before they implant, and they will be able to say, I want to do the female, I want to do the boy. They can do that. Go. Sure. So adoption is available, and women or couples who are not able to conceive, they should always have that as an option if they really want to have a child, and through social services. And the other option will be if the issue is the man is not able to produce sperm and the woman's able to have the eggs, there is something called also sperm donation. But we don't do these things in Botswana, so we refer the patients to South Africa. So you can have sperm donation, and then you go there and do, obviously the route that you have to take there is in vitro fertilization. If the man has sperm and they are also not, the woman has no eggs, there are also issues where you have got egg donors, you can get egg donation, and then you do IVF. If they both have nothing, which is very rare, you can either have donation both sides if the uterus is okay, and then you have a baby. That is if you don't want to adopt, you want a baby that you guys have carried from the beginning and in nature, from the conception as your own. But adoption will be another way to go. And then surrogacy is necessary when the woman has got a uterine issue, that they are not able to, they probably have got eggs, but they don't have an environment, the uterine environment that can house a baby. Either you have got uterine fibroids, or you've got scarring, or you've got severe endometriosis. So then you can do surrogacy. Some do it with the family, or you can also choose somebody you trust. So then surrogacy just means that we now do like IVF. So they will harvest the eggs of the woman and then take the sperm of the man and then do in vitro fertilization. And then when the zygote is ready, because the woman can't house it, then this person takes the pregnancy. It gets implanted into another person who then carries the pregnancy on behalf of the couple. Is it? Okay, so fertility management is between, if it's men, it's between endocrinology, which I am, and then urologists, which then deal with the anatomy and parts, and then if it's female, it would be endocrinologist and gynecologist and embryologist, all will come together. So the actual egg harvesting will be done by the gynecologist. So egg freezing is important because you can freeze the egg, or you can actually freeze the say you want to do, they want to do IVF, and then they have like 10 embryos. So because it's not 100% that if you take 2 and you implant them, they will definitely implant. So that you might actually, they might not take. So it's advantageous to have frozen those embryos, because then you don't have to start through the whole process, because the process is very expensive. So it cuts costs. But also later on, when maybe you want another child, you just go back. If the first one is successful, you just go back for the embryos that you have frozen. Egg freezing is usually done. Some people do egg freezing when they know they are getting old, or sometimes cancer patients who are going to receive toxic medications that will destroy the ovaries. Then they want to freeze their eggs so that then it improves their chances of being pregnant, getting. I mean, they want to have the genetic babies, to say the babies who have got their genetic makeup. So chemotherapy is very toxic to the testes as well as to the ovary, to the eggs. So sometimes after chemotherapy, they might not able to have ovulation and that. So we advise them to freeze the eggs so that later on. But once the eggs are frozen, obviously the only way you can conceive after that is intrauterine, in vitro fertilization. So there are advantages of that. But why we don't have it in Botswana, we are behind in a lot of things. We don't have a lot of expertise to do that yet, and we don't have fertility doctors. We have one who is just studied fertility, but he's not started doing the procedures yet. And we have very few endocrinologists. I think in the public sector, I'm the only one. And then we have 2 other Botswana in the private. We do have gynecologists, but after that, one needs to, although after gynecology, you need to do reproductive and fertility medicine, which majority have not done. So maybe we will get there, but we have referred most of our patients across the border, and we have had successful stories.
Management of couple infertility. Sorry, this takes a bit of time. All right, so we will go through physiology of fertility. I think the previous speaker has spoken much about the anatomy, the physiology, so this will just be a review of the topic. We will talk about the causes of infertility, basic treatments, and lastly we will talk about why we should not stigmatize infertility. So basically, the anatomy of the reproductive system. As females, we do have a uterus where the baby grows. We do have fallopian tubes, and we do have ovaries. Our eggs or ovums are produced in the ovaries, and then they travel through the fallopian tube, and where fertilization occurs, and then the baby implants and grows in the uterus. Of course, the reproductive system is controlled by hormones which are produced in the brain and as well as in the ovaries for females. For males, we do have testicles where we produce our sperms. We do have the penis, and of course we do have hormones which are both from the brain and the testes, as said before. This is a pictorial representation of the male reproductive system. The external genitalia is what we see when we examine our patients. Of course, we can see the penis and the scrotum. And the internal structures are the testes, where our sperms are made, the epididymis, where they are stored and matured, and we do have the urethra, we do have the glans penis. So basically, this picture shows us the male anatomy. For the females, the external genitalia, what we see is the vulva or the vagina. And as females, we have a cervix, the uterine cavity or the uterus, as I've said, the fallopian tube, as well as the ovary. I do think we all went through biology at school, and this was a very common picture for all of us, right? Right, so how is a baby conceived? This message cannot be said enough. It takes two people to make a baby. 1 plus 1 is 2, right? Or 1 in case of that we make one baby. So a female produces an egg, the ovum, and a male produces the sperm. When these two meet during sexual activity, there is what you call fertilization, where the sperm penetrates the ovum and there is fertilization. And then post-fertilization, the fertilized ovum implants in the uterus or the womb. This is where pregnancy occurs, the baby grows, and we ultimately give birth after 9 months. Infertility can occur anywhere in the cycle that we've just talked about, starting from your hormones in the brain, starting from your reproductive system, both males and females. Right, so for fertilization to occur, as you said before, 1, you need a healthy sperm. A healthy sperm is one that has a head and a tail and moves about accordingly. So the sperm needs to be deposited into the vagina or the vaginal valve, and then the sperm penetrates the vagina and heads towards the uterus. At the same time, you also need to have an ovum that has been produced, a healthy ovum produced from the ovaries. And this ovum needs to be ovulated, where it is goes from the ovary into the fallopian tube. It is in the fallopian tube where fertilization occurs. So the ovum has to be released from the ovary into the fallopian tube in order for fertilization to occur. After fertilization, the fertilized ovum then travels to the uterus, implants, and then there is implantation is followed by pregnancy. So following fertilization in the fallopian tube, the fertilized ovum divides into many cells, and it grows as the days go by. And in its path, it grows from the fallopian tube towards the uterus, and ultimately implants in the uterus. So you do need to have a functional ovum. You do need to have a functional fallopian tube, which can transport the fertilized ovum into the uterus for implantation. And you do need to have a functional uterine wall that can sustain implantation in order to get pregnant. And of course, you do need to have a functional sperm that can penetrate the ovum for fertilization. So, main causes of infertility, as we have covered this before, there are many factors that can lead to infertility. Sometimes men can not be able to produce sperm, where when you evaluate the semen, there is no sperm, or we don't have adequate number of sperms in the semen. Sperms can be produced, but of poor quality. They either have no tails, they have dysfunctional hairs, and they therefore cannot fertilize the ova. For female factors, we can have ovulatory dysfunctions, where we cannot produce ova on a monthly basis. The commonest cause of infertility, especially in Southern Africa, is blocked tubes. Our tubes can be blocked, which then impedes fertilization. This mostly results from infection. Sometimes we cannot get pregnant because the uterus is unfavorable to implantation. There is distortion, or there is distortion in the uterus, and therefore we cannot implant. The message here is that it takes two to make a baby, and therefore either of the two can be the problem, which can lead to infertility. As said before, there are both male factors and female factors, and they contribute equally to infertility. We find that male factor brings about 30% of causes, female factors responsible for 30% of causes. And as said before, sometimes we have couples who are unable to get pregnant, but when we examine them, do all the investigations, we cannot find explanation as to why they cannot conceive. And this is unexplained infertility, occurs in 10% of cases. This is just a pictorial representation of the previous slide. So again, there are many causes of infertility, both on the male and female side. So how do we treat infertility? First, we should define infertility. As the doctor has said, the couple should have had regular sexual intercourse for at least 1 year, and the female should have been on any contraceptive. So after 1 year of failing to conceive, then a couple may be considered infertile. So we can find the cause of infertility by, one, diagnosing infertility, listening to the story of couples not being able to get pregnant, examining them, and doing investigations. There are investigations that can be done through the laboratory, such as hormonal profiling. We can do imaging investigations, such as ultrasound, to find out the cause of the infertility. Major causes of infertility, commonest causes of infertility, like I said, are infections, untreated sexually transmitted infections. Miscarriages can lead to infections. Miscarriages can also lead to distortion of the uterus, where we have to, if we have to do evacuation over and over, it can lead to women not being able to conceive. Again, blocked tubes in women are the commonest, also resulting from infections. Poor quality sperms in men can also lead to infertility issues. And this can only be found out when we do the appropriate investigations. Doing investigations and finding the cause of infertility helps us in treating infertility, and therefore affording couples the ability to get treated and have a chance to get pregnant. For infections, given the relevant treatment when we diagnose the infection. In order to treat said infections, we have to, one, acknowledge when we have infections, present to the relevant people so that we can be treated. Other treatments include, of course, hormonal treatment. If we've done laboratory investigations and found out there are hormonal problems. We also have assisted reproduction for infertility, both for the males and females. In women, there are surgical treatments that can be done depending on the cause of infertility. For women whose causes are fibroids, which would lead to problems with implantation, we can do surgeries to remove such fibroids and increase the chances of getting pregnant. And tubes, we can unblock the tubes if we diagnose that a woman has blocked tubes. And of course, as I said, we can also do assisted reproduction. Medically assisted reproduction, we do have artificial insemination. Basically, we find a man's sperm is inserted into a woman's reproductive system, allowing for fertilization. We can do artificial insemination either through the use of a partner's sperm, if the partner does not have male factor infertility, or we can use a donor sperm if the cause of the infertility infertility is due to a male factor. In vitro fertilization, another form of medically assisted reproduction where we do fertilization in a laboratory, right? Where we collect a woman's ova and men's sperm, and then in a dish in a laboratory we do allow fertilization, and then that is implanted into the women. Another form of IVF called intracystoplasmic sperm injection, commonly used for when men have male factor infertility. In this method, we just pick one good sperm from a man and we inject it into a woman's ova, and then we implant in the uterus. We also can do donation of gametes if both the men or the women have, a man has no good sperms or woman has no ova, we can do donation of gametes. In order to do medically assisted reproduction, there are a lot of resources that need to be in place. One, you need to have the expertise who know how to do such things. Two, you need to have the right equipment, the right laboratories, and also you need to have legislation that puts the processes in place, and we need to set up good medical ethics in order for medical assisted reproduction techniques to work for us. As said before, unfortunately in Botswana, we do not yet have this, and therefore we can only send patients abroad. Coming towards the end of my presentation, why is it that women are stigmatized? I think the doctor gave a very good example for it. Why is it always a women's problem? It is because, one, we associate the word sterile with just the women. Infertility is a woman's problem, right? Women who cannot bear children are seen as not women enough. And also, women are stigmatized, as we've watched the video before. Women are abused for infertility issues, even when we have not diagnosed women with infertility. Remember, we said it takes two, and the only way we can know where the problem is if we do investigations. So infertility is often associated with women, and I think our biggest message through the Merck Foundation is that we should stop infertility stigma. So I think that's one of the main reasons why we are here. Okay, so why again there is inequality between men and women in our society. You find, like we said, it is always a women's problem. It is always mostly women who depend on men for their livelihood. It is often difficult to get men to come for consultation rooms, so that you have a couple who has infertility issues. As the woman who comes a lot of time, I cannot get pregnant. And when we advise, can they bring a partner along so that we investigate two of you, because we know it takes two. It's often one of the challenges that we find. Men are not coming forth in terms of seeking help for infertility or couple infertility. Another issue, poor management of infertility problems. Often patients who have infertility take long to get the right treatment, either because of where they are, they cannot reach the right people, or they simply do not know that they have this problem, or we fail them because of we cannot adequately pick that this needs somebody of higher expertise, and often it takes a long time for women to get treatment. behavioral health pyramid. Often the healthcare system, the way in which we refer patients, women take long to reach to where they need to be in order to be rightfully treated. These are some of the things that affect women who have infertility issues. Okay, here we do have a reference to a study that was done in Cameroon. This study was focused on major problems of infertility management in Cameroon, and what the study found was that one, there is a lot of infertility, right? And of course, stigma towards the women. It is the women's problem, and one of the major issues that was found is that there is no qualified medical staff. Patients do not have access to the relevant people, and of course, the cost of fertility management. Fertility management is very, very expensive, and this is similar to everywhere in Africa. In Botswana, we experience the same thing. As the doctor has said, fertility treatment is quite expensive, and we do not yet have the relevant or the right specialists or expertise to institute fertility management. This pyramid represents the healthcare levels that often women or couples go through when they seek treatment. At the lowest level, they often start anywhere that they can start, either traditional healer, because what they have, or primary care setting, presenting with problems, and the next level would be in Botswana, a general practitioner. That would be your next level. The amount of time it takes to go from the first level to the second level also compounds on how soon we can offer treatment to our patients. Our third and fourth level are consultative specialists, and we do know that we do have a challenge in terms of getting consultation with the specialist, booking for consultation with the specialist. Those are some of the challenges that we face. This is generally the flow of care for fertility across Africa. This is an example of how a woman would go through when they present with issues of infertility. Starting at the lowest level, you find that we do non-specific treatment. And in our setting, our lowest level will be our health course. And you'll find that women often present early with issues of pertaining to infertility. I have a discharge, I have low abdominal pains. We give them non-specific treatment. The next level we send them to, we still do give them non-specific treatment. However, sometimes, depending on where they present, we can start our investigations. The most important thing to take away from this is how long it takes them to reach the relevant people. So the question is, how do we cap this? What is it that we should do so that when women present, there is a timely attendance, they get treatment at the right time? One, let's talk more about infertility. Let's make it a problem. Let's make it a common thing. Let's not stigmatize it. Let everybody know that infertility, just like hypertension, is a disease. You need to present, you need to be seen, you need to be given the right treatment at the right time. And then let's have more expertise so that when women present with this, they are rightfully sent to the relevant people on time. And how do we fight against stigma? Education at all levels. Education to our young people, education to our youth, education to our men. Training of adults and young people. We cannot forget the major role of the media. For people to know about infertility, the media has to carry the message, which we hope they will do. involvement of civil society, and we cannot not talk about the role of public authorities. If our people in power talk about infertility and make it a topic that is well discussed, then people will pay attention to it. Thank you very much.
As said, I'm Dr. Millipore Sigma, I'm a family physician. We are going to be talking about diabetes and hypertension. And hopefully from this lecture, you will be able to promote healthy lifestyle and raise awareness about prevention and early detection of both diabetes and hypertension. And we will also touch on how to report it about it to the community. Now we'll start with non-communicable diseases. We all know what non-communicable diseases are. Those diseases that are not transmitted from one person to another. Again, not like COVID or the flu or STI. So we are talking about cancer, hypertension, chronic respiratory disease, or asthma or COPD. So the non-communicable diseases result from combination of both genetic, physiological, environmental, and behavioral factors. Behavioral factors are very, very important because when you look at both diabetes and hypertension, it's something that we can do, whether to delay progression or halt both diseases. It is a leading cause of death worldwide and presents an emerging global health threat. NCDs kill about 41 million people globally a year, and about 74% of that is coming from our middle income, low income countries like ours. So as already said, examples include high blood pressure, diabetes, heart disease, stroke, chronic respiratory disease, cancer. There are many of them. These are just examples. Now we will talk about diabetes. So we all know in diabetes there is chronic elevated levels of blood sugar, which at the end leads to serious damage to the heart, the blood vessels, the eyes, the kidneys, and the nerves. So some symptoms include excessive thirst, what we call polydipsia. Some people will drink a lot of water. Actually, I had an uncle who was telling me that, hey, I'm very healthy, I'm drinking a lot of water. And then I told him, no, what are we and then excessive appetite, excessive urination. In the extreme forms of diabetes, a person can produce up to 15 liters of urine. cauliflower, beans, peas, or what, little lettuce. And then half should have been your starch. Okay, your starch, not a quarter, not half. Your starch measured fist, yeah, and then another quarter in your proteins. So it is also important for especially the fats. Mahura from as we all know. So it is recommended. You know, canola oil, olive oil, so those ones get to say but it's a animal fat. We must try to avoid. Now, prevention of diabetes. What are all these things? Even if you have diabetes, there are already better controls. So healthy body weight, calculate that here, 18.5 to 24.9 kg per meter squared. It's a normal BMI. And then being physically active. It is recommended for adults that they exercise, moderate intensity exercise, 150 minutes a week. That translates to about 30 minutes for 5 days a week. For Monday until Friday, 30 minutes moderate intensity exercise. And then healthy diet, as already mentioned. Avoid tobacco use. I've already mentioned tobacco predisposes people to having diabetes. Now we'll move on to hypertension. Hypertension is a silent killer. So it is called a silent killer because most of patients who have hypertension don't have any symptoms. Actually, 50% of us may have hypertension. So if it is diagnosed if and when measured in two different ways, systolic blood pressure more than 140 and or high more than 90 liters on both days. Two different days. So condition high blood pressure persists consistently in the blood vessels. There's so much blood okay? And it is a leading risk factor for cardiovascular disease. Now, modifiable risk factors include physical inactivity. I've already spoken about it. It's the same for everything. 150 minutes a week, at least of moderate intensity exercise. For yoga or if you don't stop, brisk walking until you get your heart beating fast and you have consumption of alcohol and tobacco and being overweight. So the non-modifiable ones are hypertension, age more than 65, or coexisting diseases such as diabetes, primary diabetes, and it will cause stroke, heart attack, and kidney damage. But then also, when the pressure is very, very high, the blood vessels can just burst. And if they burst in your brain, it is called hemorrhagic stroke. When there is narrowing, stiffening, and it is called ischemic stroke. So there are two types of strokes. But this one, both of them can have blood vessel together and you bleed into your brain. You have a hemorrhagic stroke. And in the heart, you have heart attack, just like diabetes, heart attack, angina. And the other one is you have what is called heart failure. Most heart failure is comes from because there's so much pressure in the vessels. Can't let the heart enlarges, try to avoid expansion. And then it goes on to cardiac failure, which also comes with that. Now, prevention of high blood pressure includes reducing salt intake to 5 grams daily. We know what the government has, it's in the text area of some salt. So it is very, very important. That's why. Eating fruits and vegetables. Avoid saturated fats and trans fats. Don't eat your ratang with just the beggarats. So now every weekend, how do they don't take avoiding smoking, reduce alcohol intake. The recommended amount of alcohol for adults is 14 units a week. 14 units translates to around 10 cans. 10 cans, but it must not be more than 4 cans in a city. So more than a arrange that is 6 pack is not recommended. More predisposed to hypertension. And be physically active every day, like already. Now you can control it by following advice of Naka. And I adhere to the lifestyle changes that I have already mentioned. Taking medications as prescribed, regular blood check. I told you what, even if you don't have hypertension or diabetes, you can go to any health facility or go check at least once a year. Reduce and manage stresses and influences. Now, with what I have already mentioned, your role is to provide important link between your residents and health information. You help to expand the audience reach and you educate the public about health concerns. We know how media was very, very, very important during the COVID times. But however, media is responsible to report accurate health yes, oh, yes, I think I know what you want to ask. No worker erectile dysfunction, I can. Yes. No, 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 it's indeed common. We have those patients in our clinics. And it's how you assess them, serologically. But then there are also medications for that. It's just that for men, the medication is very pricey. But it's like 400 for four tablets. But we do. Okay, these are questions. I thank you.
So I've been asked to talk on the influence of infertility stigma and other social issues, child marriage, the FGM on women and couples. Already we have had many speakers talking on the issue of infertility. That's the mini outline that we'll go through. All the speakers like I said, this is not the presentation that I had initially, that I sent as the final draft. There are social problems that pop up with these issues that we've been talking about. There is isolation when you are embarrassed, when you are humiliated because of a natural occurrence in your health status. You tend to avoid being shunned, you tend to avoid having more so you isolate yourself, and isolating yourself then pops up the psychological problems of when you are alone. Oftentimes that is when the mind goes into dark places, and we have the development of mental disorders. We are talking about the depressive disorders, we are talking about the whole shebang of anxiety disorders. Okay, so I will take very simple questions.
Let me first of all acknowledge the presence of Etienne and the presence of all of you. And to say this is perhaps for me a lesson, because from speaking that we've been speaking, it was all about health, and so much health. And I'm expected at least to take a junction this time to try and talk about the role of media, right? And in talking about the role of media, of course, we'll be looking into what we can do as media and see to it that at the end of the day, what we do much better. I've been already introduced. What we will be talking about to explain the role of media in society. It is very key that we understand what the media does. Traditionally, we've learned that the media is for this thing. This is per se just vocabulary, but in actual fact, the media is what is giving us stories, what is expounding our narrative, putting us into some kind of a book as a society. And then also to understand the impact that the media take in health and social issues, and then highlighting new supporting practices. The first most important thing is to understand the process, what it does involve. When the media is giving out information to society, what does it involve? It involves creating a message. This message is the one which people are going to get. Now, you may think that the message is about just telling people what they have to do, but the message can come with various definitions and be packaged in various ways, for which at the end of the day, there may be another narrative that comes from this message. And then this message is communicated through a channel. We have television, we have radio, we have newspapers, we have social media, we have various platforms through which we communicate the message. And sometimes it's about accessibility, sometimes about skills in terms of operating, or in terms of maybe even listening and consuming that. Then we are also looking into the fact that some everything was normal. But then the way they put the story, say, this is the second incident happened in Francistown area. And by the way, if any third incident happens, you know that already is a story on itself, right? Now, media is a representation of society. Media fit into the character of society. Many of us perhaps watch telenovelas, common subway generations and the like, and you sometimes see that the way they put stuff in terms of the scenes and the frames that we see, it is really interesting us. And this is what is making us get hooked to television, get hooked to what they are doing. Take your big brother night. When you are part of that type of lifestyle, it is easy for you to always hook to television so that you can be part of the audience. It is just that they are really representing yourself or representing what you prefer most. This is why people have the type of film they love, the type of news they prefer. You find that a businessman will never care about anything in the news except the business section. Right? Then we have media in society. For some time, we have the media even putting government into power. That's what media can do. Media can go an extra mile. It can even change the perspective of society. It's not that I don't think there has been any study done, but in the past, I learned that I think it started around 2000 again, murder suicide, which had to do with what we call love and people murdering others because they felt like they loved them too much, they couldn't separate. This started to be common. It was reported in the media, and then someone was remarking and said, perhaps the rate at which we report this in the media is the one which this rate is the one which is perpetuating, so influencing this to happen so much. But it could be true because media has that power. You show people that this is what they can do. I mean, many of the young people have been alive when we're alive, but you can still see that they will have Banani Kotobo, they'll still have Bob Mali songs and preferring all these and everything around that. That is the power that media has, right? Sometimes you may imagine that there is nothing, but it can even shape the way you wear your clothes. It can even change the way you talk, the way you walk, the way you relate with others. That's what media can do. Now, with the content, let's imagine this is the message that you are giving to the people. These are journalists as practitioners, maybe media people as practitioners. Then we have what we refer to as news values. Content would include maybe music. The music that we listen to, sometimes they have stories, sometimes they have messages. Then sometimes there's maybe internet content, television programs, news, magazine, current affairs, all around us. All this is all around us. Some of the content is not necessarily news as you imagine, but it's still very influential to our lifestyle. And then we have practitioners being those who are putting up the content, those who are producing the content. They construct messages that include, at least for the sake of this workshop, they construct messages that include health and social issues as part of the content. And in doing that, they select what to say from volumes of data around them. There is always so much around us, right? And when the journalists go out to collect content, they are going to have a lot of data. Now it depends on intuition, sometimes their qualifications, sometimes their experience, sometimes the regulations, sometimes the policies in the industry that is going to help them decide on what to put out there and what not to do. Sometimes they've been influenced by the ethical considerations, right? And then they will now, in doing that, they control the agenda of the story. When I talk about murder suicide at one place, how do I put the story? I think a couple of years ago you have television, of course, will say BTV because that's the only television we have. BTV reporting a story about a young lady being killed in a hut in a house in Kokwe. When they put the story, they try to put it into that perspective that people will understand. But sometimes the message, how it's presented, is going to come with, some other narratives how it came about, but someone probably threw it in social media. There was that thing about two guys trying to talk, thinking a sport mobility. Right? You remember the story? The way it was put, if you look at it, it has already said women carry HIV, women will bring HIV to you, right? And I think the creators of this, they never even thought about all these. They were just thinking we are trying to send a message about compromise, right? And then you also have to understand that for the content that we are putting out, sometimes it's creating some kind of relations among ourselves, sometimes it's creating some kind of knowledge which we didn't even bargain for. But what this calls us to do is to carefully analyze what we should include in the content and what we should exclude, so that at the end of the day, the messages are constructed to kind of provide so much which is to do with changing the perspective of society to the best, right? The messages become very effective. In terms of communicating key health and social issues, there are issues around infertility, stigma, which has been talked about here, issues around girls' education and child marriage and the violence, female income. Let's just take a story. This one is very interesting. Every year when the Cambridge results are Cambridge results are released, the biggest factor that is put forth is the number of females versus the number of males in terms of passing. The number of males and females, science, this and this. You know what that is doing? It's already creating a story of comparing the genders in society, whether we like it or not. And we are doing this even at high level, right? Such that even at low level, when we put up that story, we have already agreed as society that females are in comparison with males when it comes to sciences or choosing meds and the like, and we are already saying, can we see any change here? Can we see anything? And this is now done in media, meaning that the media is addressing this position, right? There is also aspects of end child marriage. Before perhaps social media has a role to play, even though we may not see it as the mainstream media of society. But the moment we see, I think I've seen another video where an old man was marrying a young girl. The moment we see that on social media, we are starting to accept it. I think the recent, if you look at media, especially in entertainment, you'll see that homosexuality is starting to be accepted, and now they are having, all these guys coming on television to talk about they're not really talking about homosexuality, but they're presenting themselves on television. Do we call them homosexuals? If I'm not putting it properly, you forgive, okay? But you'll see also Mizo's programs, more televisioning, you see other guys' programs. This is to show that in South Africa they have accepted this. And the moment, without saying we have accepted it, it's just part of lifestyle for them. The moment it comes to our television, know that also be saying a message, even if you are not saying anything about it, right? But just because it's appearing as part of society. There are also ways in which we can deal with diseases and complexities. Believe you me, if I were to ask how many journalists are here, I think there will be few. But what I've realized is much of the content that we received earlier was very scientific, right? It is very close to the classroom, especially science lessons and the like. Now we have to decipher it for the individual person out there, for the someone who has never been to the, someone who cannot really understand diabetes as the way diabetes, right? Someone who can understand it in another perspective. This is where the media comes in to try and make it clear. So what we need to do as the media needs to reach out to communities at grassroots level and raise awareness on health and social issues. The biggest problem we have in Botswana is most of our media is central to Gaborone, right? And you'll agree with me that the only time we talk about anything happening in the village is when the voice has gone there, or Millipore Sigma has gone there, or maybe the president was there. But we cannot go to that community and talk about just so that we can help that community be recognized and be assisted. We cannot, the only time you'll hear about people, I mean, you hear people complaining about the roads, maybe to Maung or to whatever, is when they travel there, right? But you'll never have media really based there to try and talk about the situation at those places. So emphasize the importance of empowering the girl child on matters that relate to their health and social well-being. If we do that, we are, sometimes you can do that by just letting many of such stories appear in media. Sometimes you can do that by really, creating narratives that will drive towards those issues, and then create a cultural change in society. Believe you me, when I think it was a couple of years ago again, we have people now talking about religion coming into try and being a solution at some point, and when they realized there wasn't any solution, they dumped everything around and then seemed to think. And then you go to a church, it's a pastor first, the voice of the church, everything around them. You go into a village, it's the posse, it's the head of everything. So anytime a story evolves, it's going to be central to these people. What about the real people? Culture change is very, very important. We have to try and let it off. Know that people can also create stories, not only what we call important people. I know when we do news filtering, it's always important to really feature a post in a village, or it's already important to feature headmaster in school and the like. But sometimes go to the real students, create a story from them, right? Sometimes go to the real girls, create a story from them, and let's see what will come out of it. Other than going to the teacher of gender issues, and that teacher is going to give you a book, an influence textbook story. Also create awareness of health and social issues. Is quite related to what I'm trying to say. Create fitting agenda for communication when they construct news. Fitting agenda. I gave an example earlier to say, you'll say a man has killed a woman versus a woman has been killed by a man. Right? Unprotected woman. A woman has been killed by a man. A man has killed a woman. Barbaric man. This is how the perspectives are put. And such content is always going to leave the audience that to try and respond. When they respond, they create narratives themselves. There's also what I think we can do, and this one is trying to do much better as the media. One, apply frameworks to analyze and structure information. Go into information, understand what is being communicated, get educated, understand what you need to communicate, what you need to send out to people if you are the media. Then develop interesting narratives, translating issues into good stories. We've been getting animated videos around. There was a story, a billboard a couple of years ago. In MOKGWEETSI House, says avoid AIDS, AIDS. There was a time when we really fight HIV as a nation. Then it says avoid AIDS, AIDS. You can imagine, even up to today, there's no secondary school or primary school anything around that vicinity. Who was it talking to? Right? It probably was talking to motorists. Will they really respond to that? So sometimes when you put up such narratives, even the placement matters. Right? Even where we are going to communicate. There are some things that are sweet for television, some things that are sweet for radio, some things that are sweet for newspapers. And also even understanding if your audience can access this content. Information dissemination through storytelling, present features, pay attention to ethical issues, and set and present significant and effective agenda. Is what you refer to as agenda setting. If you want to check whether you should, as a journalist, you should present a story the way you are presenting it, the first check is place the audience to be, or maybe imagine the audience to be, the affected to be your sister or brother. The moment you do that, the story starts to make sense to you, right? Try to say, okay, can this, I'm talking about rape here, and this is how I'm putting the story. The moment you do that, imagine that rape was involving your relative. Then you write the story much, much better. Develop issues just for framing of issues. In many of our newspapers, I'm concentrating mostly on politics, sports, lifestyle, forget that our real life is actually at home. And for that, I've never had any desk about the social issues in newspapers, or social issues at radio, or social issues on television. It's always sports. It's always politics. It's always, we live out real. And then the next thing, newspapers are going to come and say, can we have funding? Funding to do what? Because you are not doing the real, right? If you really need, in fact, if you check the trend, those who will be funded nowadays, those who talk about climate change, all those things that are really affecting people, drought, I want to believe if you are also going to cover stories that deal with societal issues, deep in those fields, health, you'll probably have funding. You will not even seek advertising, you'll have funding for those stories. And then mobilize society, social responsibility, and promote participation. It is quite very important that when you write, you also see yourself. I think when Mehale was Medindo was talking about her experience, sometimes it takes boldness to try and show society what you believe in, what you can do as a journalist. You know why? They sometimes need journalists. Journalists are really our mirror. They are really those people we look up to. When you appear on television, don't take it as a joke. You have someone you're impacting. You have someone looking up to you. It's unlike, maybe I'll say, it's unlike saying, when I grew up, I want to be a policeman. When I grew up, I want to be a nurse. It is basically now practical. Oh, I want to talk like that lady. I want to talk like that lady. And the moment you see yourself impacted, now even impact. Take initiatives. Talk about diabetes. When they go for diabetes riding and whatever, be part of it as a journalist, right? So that they can see the reality of this. Sometimes we see cyclists only doing it, and we imagine it's a club for cyclists. But imagine if journalists are going to be part of this, right? And then build sustainability. Ensure there is continuity in the reporting. Ensure there is continuity in what, right? This is what the agenda, the SDG are talking about, mainly sustainability. Let's ensure that we continue the story so that by 2036, for Botswana, 2030, whatever, for SDGs, will be at that level, right? Thank you so much. That's what I want to say.
So the media's role in promoting a healthier Botswana while making sure that we promote a health-seeking behavior and preventing stigma. And this is by following medical ethics and media ethics as well. So next slide, please. So accuracy and verification on medical information is testament to any reporting. As media professionals, this is synonymous to what you report. However, it's very important when it comes to health and medicine. Inaccurate, misleading, and sometimes fake information creates confusion for people, and this causes mistrust of the health professionals and prevents people from actually getting health care they needed. An example of this is close to like when COVID came out. There was a lot of mistrust going around, a lot of people assuming different things. And to be honest with you, as medical professionals, at that point of time, we also didn't know much of what was going on. But again, some people didn't seek help or didn't, and we saw that those people sometimes got worse outcomes. So this is very important. Next slide, please. The patient privacy and confidentiality is something really, really important. As we know, the Data Protection Act is coming into Botswana. So it should come in the next few months. Given the possibility of using unauthorized data and posting it on social media or companies or third parties, or any information that can identify a specific person without their knowledge, this can be detrimental as well. For example, say there's an outbreak of foot and mouth disease at a crash in a certain place in Gaborone. We want to try and prevent stigma and prevent people, so meaning that parents who have a child that was playing with some toys and now ended up getting foot and mouth disease, they don't get stigmatized where, you know, there's something wrong with your kid, you have sores all over your mouth or your hands, and so on. So, you know, trying to make sure that when we're reporting certain things, getting consents from certain individuals, if they're going to be identifiable, or being a bit more empathic with that reporting. Next slide, please. So when we report on health issues or topics, we need to address, obviously, the ethical responsibility to avoid sensationalization of news and fear-mongering. Discuss how balanced and responsible reporting can actually contribute to public trust in the media, as well as the medical community. And the role of journalists in educating the public without creating fear or stigma. As I mentioned earlier on, this allows the public to actually get better health-seeking behavior, and instead of feeling stigmatized about certain conditions and so on. You know, this allows us to say that the media is actually one of the most powerful organizations in order to actually getting a healthier Botswana, and we know a healthy nation is a productive nation. Next slide, please. So educational campaigns, we've seen, I'm not sure, because we're Gaborone based, we'll talk a lot about Botswana, but you'll see, if you go now, it's now what, close to 5, if you go towards the airport or go towards CBD, you'll see a lot of people running on the road, you see a lot of people at the back of CBD doing, you know, fitness activities and so on. So educational campaigns are also really important, and you know, encouraging people to do physical activity or develop educational sort of elements that can be accessed by everyone as well. So you know, sometimes people will say, oh, take out a gym membership, but a gym membership is not something that everyone can afford, nor everyone has access to. But saying to someone, you know, go for a walk at least 3 times a week. We all can take a walk 3 times a week. Or there's outdoor gyms that are now being developed as well. And you know, when doing educational campaigns, use credible sources and experts to relate these campaigns. So if you do an educational campaign on a healthcare activity, try and maybe report from a health expert or someone who has some knowledge on those topics. So the person reading or the person seeing these campaigns has more you know, trust into that article. The next slide, please. So next, please. So highlighting success stories is also really important. Success stories, basically, everyone likes good news. I do know bad news gets more reads, but good news is something that lifts up the spirit. And I think someone also mentioned earlier on to say, you know what, let's be spreaders of good news, and you do good news squared. And the reason is that if you share inspiring stories of individuals, obviously with getting consent from those individuals, we can overcome a lot of things. I mentioned NCDs here because NCDs is something that will affect every single one of us at some point in our life, and we want to try and prevent that or prolong it to come later. So an NCD would be you know, cancer, diabetes, hypertension, any disease that's not communicable is an NCD. And if we can give success stories to say, you know, this person here was severely overweight, but by walking 3 times a week on the A1 at 5 p.m., this person has changed their lifestyle, and I think it encourages other people to also start being more active and relating. You know, as I said, we people. So as people, we relate to one another, and success stories really enlighten a lot of us. Ensure, again, what I said is the story has consent, and you maintain privacy and dignity of the person. So as one of the other speakers had mentioned, you know, if you're reporting on something, think about it as reporting of one of your family members or someone. So you give a lot of passion to that, but also protecting that individual. Next slide, please. So partnerships with health organizations such as the Merck Foundation, these collaborations help because the companies come on with medical professionals. As non-profits, they provide accurate information and resources, and this can benefit your campaigns in health information. You can also co-host events, so webinars, interactive sessions, and engage with the public and provide practical advice on preventing NCDs, as well as infertility and so on. But it's important to know that when doing this, we by getting collaborations, it allows you as a media outlet also to get access to information you may have not gotten prior to that. So I think there's a lot of organizations that are willing to share this information as long as it's being produced in a correct way. Next slide, please. As I mentioned earlier on, promoting preventative measures. So using the media platforms to promote preventative measures such as regular screenings, vaccinations, healthy eating habits. As we've seen, Merck Foundation has just launched some booklets and videos. So these are very important, and they touch base to everyone. By creating content also like infographics and videos, getting accurate information and stats. I always tell people that data never lies. So, if you get accurate data, so if you're reporting on something, it's nice to say 90% of something is like this, but if 90% was 10 people out of and there was only 9 people and there was only 10 people that were there, yes, it's 90%, but it's not 90% of an entire population. So it's important to know that if you're using data, use the data wisely and get patients and the public engaged in a good manner. It's really, next slide please. In ethics with healthcare, it's really important to address misinformation. So actively counteracting misinformation by fact-checking. As I mentioned before, working with medical professionals and so on, this can help us quite a lot. And debunking myths related to health and NCDs. Provide clear evidence-based information that helps public make informed decisions about their health. This also, once again, as humans, we actually quite vulnerable. So we believe a lot what we read, and at times now we have Google. So if someone says, "Oh, you have a sore throat," let's Google what's wrong with my sore throat and see what's happening. But it's important to address misinformation. So we often see that patients sometimes take home remedies and so on, but we then can see that sometimes some of these remedies do work. Sometimes some of these remedies are actually toxic to us and toxic to our organs, to our kidneys and liver. So it's important, if we notice these kind of things happening, we notice that this one area has people that do certain things that are wrong for healthcare, address the misinformation and give correct information or correct guidelines for where the patient can go through to. Next slide please. Encouraging community involvement. So the community is the most important tool. So as the media enlightens the community, and the community together can work quite a bit. So promoting local health events, support groups and community resources that can help individuals, as the media also encouraging the community and giving them an audience can also help. And like I said, success stories. So if the community is involved, the community has a higher spirit, this helps quite a bit. Next slide. And I would say regular updates on health trends and research. We saw it during COVID, where we were posting how many COVID cases for this month or this week and that. But there's a lot of healthcare events that are happening all around the country, and health risks that we can report on. So keeping the public informed about the latest health trends, research and findings, and advancement in prevention of certain treatments and of NCDs and infertility and so on, and ensure the information that's shared is up to date, accurate, and presented in an accessible manner. Medicine is such that it's all the same, but it often changes and protocols change and things differ. So at one stage with HIV, a study had come out to say pregnant moms, moms that give birth that are HIV positive shouldn't breastfeed their babies. And that was, at that time, was the knowledge that they had. But I mean, now it's completely wrong. Pregnant moms who have HIV should breastfeed their babies because, you know, it's part of the algorithm and so on. So, you know, if you're reporting on something, make sure that you're reporting on the latest guidelines and the latest articles. And if you're not sure, there's a lot of experts that are available in Botswana or internationally, and just make sure, because we don't want to pass on the wrong message, because those kind of messages can actually have detrimental effects on some of the things that are happening. But you know, the take-home message is the media is one of the most powerful tools for everything. And I do believe that if we use the media in a correct manner and in a manner that can assist with health promotion, you know, creating, breaking the stigma on certain things, you know. I'll give you an example. I used to run an HIV clinic when I was still working in South Africa. And when I ran the HIV clinic, you know, patients used to come in, and it's really difficult to get sometimes patients to take medication every day and so on. But opposite me was a diabetes clinic. And I used to explain to the patients, you know, as a diabetes clinic, sometimes diabetics are coming in wheelchairs, sometimes they've lost some of their eyes, or you know, they have loose sensation and so on. And you'll see that, like, you know, certain modalities. And I said, you know, if you take a tablet once a day, every day, you can live till 100 years old with no complications. So it's about, you know, encouraging certain things. So maybe even speaking to the Ministry of Health or speaking to local doctors and saying, guys, where are you finding difficulties? Where are patients not or not adhering to certain things? And then finding how to use campaigns to encourage the patient to say, you know what, if you do this, this is going to be beneficial. Because then they're going to say, you know what, it's all over. We feel that the whole of Botswana knows about this, so there's no harm in us doing these kind of things, because we know it's the truth and it's good. But so I try to be very quick, because I know time is of the essence. But the take-home message is this: using your tools to benefit a healthier nation, and I think it's a productive nation. Thank you very much.
All right, but before we go to the next slide, we're going to talk about social media, and I realized something. A lot of people don't know the definition of social media. Just from a raise, just two people. If anybody can give me the definition of what social media is. Definitely. Yes, no, it is. So I will share that, I guess, for the knowledge today. All right, just in a nutshell, social media refers to the means of interactions among people in which they create, share, and exchange information and ideas in virtual communities and networks. Virtual, that's your big thing. It's done virtually, people interlink, they connect, they become friends, they like each other's statuses, they share CVs, they share everything that is sometimes a little bit too personal. So one of the advantages, though, as much as I said there can be some dangers, there are some advantages. You're staying connected, you have access to news and current events. How many of us have seen a breaking story first before you hear it on TV or on radio? And I'm a broadcaster. I'm always on social media. A lot of people said social media will probably be the end of radio. Mind you, I'm biased. Been in radio for the last 10 years or so. I don't think it is. It's not. And I will tell you why. Radio is real. It's real time. It's generally researched. A lot of things that you get on social media, unfortunately, some of it is not true. So that's why we now have to interact and ensure that we're all on different platforms on radio, whether it's FM, online, and we have to go into podcasting and also on the social media. It's a personal brand. Social media is fantastic. It grows your business. It grows who you are. It grows your market. It actually grows your market across borders, which I absolutely love. Business opportunities, convenience, ease access fosters innovation. For me, that's a personal favorite, now that we're getting into a landscape of artificial intelligence, which I think is the future for anything, for any medium, whether it's health, education, social media, radio, you name it. Artificial intelligence, I think, is the next big thing. It also provides entertainment. Absolutely love it. Remember during COVID, I always say, if it wasn't for the artists, musicians, keeping us sane truly during our lockdowns, it would have been a tough time. A lot of the moments we got was from social media, the videos, there was lockdown parties, virtual parties, if you remember. Those were fantastic. Platforms societal change, promotes skill development, and also supplements to education. Although the last one, I must take caution. A lot of people, I ask, do you read a book? Do you read monthly, weekly? And a lot of people say they get their information on social media. Please do still research and read books out there. Disadvantages, I will go through them in a nutshell. We all know them. You know, distraction, loss of productivity. A lot of us work, we're not working fully optimally. We're on social media, bullying, harassment, anxiety and depression, which is actually growing by the day. I always say that if we can, as parents, if kids cannot be on social media, at least by the age of 18, I know it's difficult, but it really promotes a lot of anxiety and depression among teens. It also helps spread scams. A lot of people have been scammed, and it has addiction. So it does have some disadvantages. So one of our biggest topics today, I will share the article also. It's about the role of social media of people affected with infertility, which is our big topic today. And it's a really great article. We're from the academic background, so we read a lot of journals. So please read a lot of journals that you can get and access online. I'm happy to share this slide. And in a nutshell, one of the highlights that came about is that, you know, there are fertility treatments, there are issues that people are facing. But what is happening is, when you're seeing a lot of social media, people who are successful having babies, it can cause you anxiety. Why not me? Yes, you're happy for the next person, but it's also not a great place to be, to see the happiness of others. You also become emotionally affected, especially when other people share. Even if it's a story related to you, it can actually also affect you mentally. I'm not saying you shouldn't go on social media. I'm just saying that the caution that you go when you're going through these aspects. Feeling of despair described by other forum members were experienced. As I said, jealousy for those who had successful treatments and gave birth, and depression, anxiety, and all those issues were seen, especially from this article. And I think also, Hannah, you touched up on it. You know, when you're going through something, it relates, it affects you more when you're seeing somebody speak about it. And I always say, you know, whenever I see somebody posting, and it happens a lot on social media, you'll see somebody will post at the beach having a good time, and somebody will have something so negative. If you've got nothing positive to say, don't say it. I see it a lot now when the election's coming. I see it a lot when, I'll give a general one. There's a Miss South Africa happening, and I think one of the contestants, she was born and raised in South Africa, but her parents are Nigerian origin. And you should see the comments underneath her. You are not South African. Why do you want to, run? You want to steal from us? Little things like that, which you're like, but she was born and raised there. She's coming onto this platform. Oh, and she has a child, which to me was just horrible. How do you come onto this platform with a child? And these are women, some of these comments. So I always say, if you've got nothing positive to say, don't say it. Unless it's something that is encouraging. For example, there's a lot of deaths, especially that have been happening GBV to children and women in the last couple of months, as you've seen. those are the things you need to stand up for and, shun it and say, this is negative, this is wrong. So that is for on the social media. As I said, it's going to be a short presentation. We're going to touch up on my other aspect, which is as media studies academia, we do a lot of photography, and I'm more into wildlife photography, but I'm going to touch on some social aspects of photography. Does anybody recognize these photographers? Okay, which one? Talifa, yes. The other two? Really? Annie, yes. Big photographer. All right. So the other gentleman is a gentleman called Kevin Carter. Do you all have your phones? I didn't want to show this picture because it's a very powerful picture. Can you just Google Kevin Carter quickly? I know we're online, Wi-Fi, it won't take you 10 seconds, and see his most famous picture. Kevin Carter, photographer. Picture. You've seen that picture? Yeah, so it's a photo. If you just go to images, you'll see his famous picture is a photo of a toddler, about 2 years old, in Sudan, suffering from malnutrition. And there's a vulture standing at the back, waiting. Yes, everybody knows the picture. They don't know the person who took the picture. This is the gentleman. And another sad story about it is the outcry of the political. Everybody was saying, why didn't he do something? It became such a big, huge story after he took it. Another sad part is he actually committed suicide a few months later from the things he had seen when he was covering such stories. So do you see how provoking and so powerful media can be? In all aspects, whether you're writing with a pen. Bella was just talking about how powerful the pen is. Whether you're taking a picture, how powerful. Annie, the one you also saw, she took the last picture for John Lennon. You all know the famous artist. And 5 hours later, he died. Literally 5 hours later. And she released those pictures. Those are also thought-provoking pictures. You're welcome to see them. We're giving you homework. See, academia, we do that. We like people to take something away. Her biggest aspect is taking pictures of famous people. The Rolling Stones, she's on covers. That is her big thing. She brings out stories around famous people, and she made her living from that. And that is one of the thought-provoking photographers. Personal favorite, Caliph Charles. I didn't ask for rights for his pictures. I wish I could have displayed them. And I think this is one of Botswana's gem. Storytelling, he loves what he does. He represents us who we are, and he is going to ensure that Botswana is very well known across the world. Okay, so that is social media and photography in a nutshell, and also just closing up today with a little bit of lightheartedness. The last pictures, those are mine. Those I have rights to. The first picture I took at the in Kasane, the second at the Delta, and that is my kingdom. So, thank you.
The media, the power of the media to influence can never be underestimated. Everybody knows that. Everybody knows that. That is why you see so much investment in different platforms. People putting millions, billions into media infrastructure because they know just how much these tools are influential in society. So they want to be at the apex of the influence of society. It's not by accident that they do that. They know the power of influence. So these tools, all of us agree that they are very influential. And that is the reason why I believe that one of the key areas that Her Excellency, the First Lady of the Republic of Botswana, being the ambassador for Merck Foundation, realized it's important to bring the media on board in order to be able to promote the causes that are promoted by this foundation, because she understands the importance and the role of the media. We have no excuse. The amount of information and knowledge that was poured on us this afternoon tells us that we do not have to look far. The information is there. It is up to us to use it and make sure that we create influences. Obviously, the major issue today was destigmatizing infertility. And it's not an easy thing to do unless you really empathize, and as a person, you understand what you're talking about. And that is why I said, and when I asked to see how many of the people in this room are in the media, and I saw those few hands, and I know those are the hands, those are the people that we expect to actually unpack this beast and be able to inform the rest of us. So I just want to say to you guys, thank you. And I want to encourage you and to inspire you to do more and to continue. And don't give up. Even if you are alone, make sure that you continue telling that story. And as Kgauna demonstrated earlier about the temptation to sacrifice empathy on the altar of sensationalism, it's there. You are the ones who can be able to ensure that doesn't happen, so that we are able not only to inform the public about infertility not being some kind of an affront to society, but a condition that not only is it treatable, and not only is it treatable, and also there are options as well as to what people can do about it. So we are really grateful that at least there are people who are really committed to ensuring that this information is passed by. Botswana is sometimes they say it's a developing country. Yes, it is a developing country, but when you look at how connected we are as a people, no matter the sparseness of this country, you can tell that all of us, one way or another, are related, which makes it even more imperative on us as the media to ensure that the way we treat issues, know that we are pointing exactly at ourselves. So I just want to encourage you, when you deal with these issues, which are very, very difficult to deal with sometimes, some issues like, for example, mental illness, issues like GVB, issues like we were talking about earlier, although in Botswana it seems not to be a major issue of maybe child marriage and so forth and so forth. Understand that you are talking about your relatives. You are talking about somebody who is not very far removed from you. So these are the issues that I think we need to not only just interrogate, but be very alive to when we report. And then the other thing is, you notice that all of the presenters here from the medical fraternity, from the health fraternity, they either reside in here or are Botswana. none of them was an expert from outside, which tells me the resource people are here. We have no choice. We have no excuse to say we don't have the information. It is there. So I just want to encourage you to approach them, engage them, get them involved, inform yourself as much as you can so that you are able to properly report. And finally, as I said, as a final thought, that it's about who we are. When you sit down and start putting a story or putting pen to paper and developing a narrative, it says more about you than it does about the story that you are writing. So you need to always ask yourself, look, these tools are there. Anybody can use them. You need to, as Dr. Lisita Okana said earlier, you need to be able to, before you put it out there, ask yourself what impact it's going to have. That's the question you have to ask yourself. Because understand that once you have said it, you cannot unsay it. And what it does in the minds of and in the lives of the people that you are writing about can sometimes cause irreparable damage. Just for this time, I want to say, you see, there's a principle in journalism that talks about objectivity. But when you are a reporter that speaks to issues that impact people, I think you are allowed to be subjective to a large extent. Subjective on the positive side. Because it's very easy to try and say, no, you are impersonal. You cannot be impersonal about a story. It's impossible. Every story carries your DNA. So as I conclude, I'd like to thank everybody who's taken their time to research and be able to share with us the amazing amount of information that you have been able to do. We would like to thank especially Her Excellency, the First Lady, for being able to engage us as the media in this fight. She has challenged us. She has actually, put a challenge out there for us, especially with the issue of cervical cancer. I believe she was really giving me an assignment, and I expect that to see that in our media. And we would also like to thank everybody concerned at the Merck Foundation, and thank you so much for your attention. I don't know what else to say. There's a reason I stuck around, because I wanted to see and hear what's going to happen.
Good afternoon, everyone. Just like to thank you all. On behalf of the Office of the First Lady, we would like to thank you all for honoring the invite and attending the Merck Foundation Health Media Training and Partnership with the now Ambassador of the Merck Foundation More Than a Mother, our First Lady, the Republic of Botswana, Her Excellency Mrs. JANE MASISI. We have sent you all a link to your emails that you may fill out the form. It's a very short form. It won't take longer than 5 minutes. So when you do have the time, please just go to your email accounts, open it up, click it, and fill it. Please do note that these forms are all anonymous, so feel free to respond as freely and as honestly as possible. Thank you.